Good morning, everyone. It's Josh at Prescription Fitness, Physical Therapy, and Sports Care here in Geneva, New York. Coming today with you with a tennis elbow hack. I was on whatever social media site, and they're talking about tennis elbow, and I thought I'd share a hack with you guys as far as a treatment option, which sometimes can be very, very successful. So, tennis elbow typically presents itself with a lot of up condyle. I did a video on this some time ago. There's actually 2 points where you can have it. You can have it at what's called a musculotendinous junction, which tends to be a little bit further down over the head of the radius, which is the bone on the thumb side of your forearm. Or it could be a little bit higher up onto the lateral epicondyle, which is part of the humerus, and that's what's called a tenoperiosteal insertion. So we have the muscle tendon junction or the tendon bone junction. In either case, it's very difficult to treat. I don't know. In my hands, anyways, it's a tough one to treat. It's sort of like plantar fasciitis. Either you're going to be a fast responder or slow responder, and there's billions of exercises out there. So whatever works. Eccentric exercises, concentric exercise, massage, soft tissue mobilization, whatever. But here's a hack for you. So if we look at my hand here, so what I'm going to do is I'm just going to draw my hand. We're going to delineate what is the ulna and then what is the radius. So I don't know if you can see those lines here. So I drew on here. So here's the ulnar side of my forearm, and here's the radial side of my forearm. Okay, so what I want to do is if I take a plastic bottle filled with water just like this, okay, I'm going to have a little piece of tape here. In this case, we're going to use athletic tape. Okay, so imagine that I have my hand, I take my water bottle, and I'm going to squeeze. So you can see where the line is to start. I'm going to squeeze that bottle. I get pain right there. So you want to make sure your arm is consistently in the same position. So a lot of times we'll start with elbow fully extended. So we'll squeeze. That's going to be the point at which I have pain. So I'm going to mark that line with my piece of tape here. So I'll just kind of mark that line. Okay, so let's say that's my starting point, so I know how high I displace that water, which is really giving you a general sense of how much grip force I was putting through it. So the mobilization technique kind of looks like this. What I'm going to do, I'm going to take a hook grip, which kind of looks like this. I'm going to grab just the radial side, so I'm going to make sure I don't grab the ulna, but I'm just going to grab the radial side of my forearm. Okay, I'm just going to gently pull. Now a lot of times I'll have it resting down in my lap, so it's kind of looking like this. And what I'm going to do is I'm just going to pull straight out. So I'm now just taking my hook grip. My arm is totally relaxed. I'm just going to pull. I'm going to hold that for a count of 7 seconds. I'm going to relax. I'm going to repeat that. 7 seconds. And relax. I'm going to do that roughly 7 times because it's easy to remember. 7 times 7. Grab a hold of my water bottle again. Arms in the same position. This is what we call litmus test. We like litmus tests because basically they're going to show us, are we doing anything? So with every physical therapy or chiropractic or any intervention that we do, we should always have a litmus test. How do we know it's working? So if I go get an adjustment, how do I know the adjustment did anything? You hear lots of cracks, but who knows? Some of the research shows that the more cavitations you hear, the less effective the treatment was. So we always want to have a litmus test, and so in this case, my litmus test was squeezing the water bottle. So I've done my 7 times 7 seconds. I squeeze again. I notice that the water now displaced higher, which means I could grip harder before the first onset of symptoms. And so I'm going to do that exercise several times a day. And very often, that's one of the first exercises that we provide to patients. What does it do exactly? Well, there's probably a whole bunch of theories in this, but let's think of maybe it just as a neuromodulator. So as a distraction type of a technique, I'm changing the tone in the muscles around that joint, which allows the joint perhaps to track better, if you want to look at it that way, or maybe it's just changing how the muscle is being recruited. Whatever it is, it seems to work pretty well. Try that next time you have tennis elbow. How do we test for tennis elbow? Do I have tennis elbow? Hold your arm out just like this. Push down on your middle finger. That hurts. Okay, that test has a high predictability for tennis elbow. I want to say that it has it's almost 100% specificity, which means if it's positive, so if the test is positive, you rule in. So it's a great test, quick test, tennis elbow. Try your self-mobilizations, see if it works. If it doesn't work, well, it's a tough one to treat anyways. So that's our hack for tennis elbow today.